what I'd like you to start with is, can you share a little bit about the work of mass lib or mass liberation and why decarceration and safety for prisoners is so urgent in Arizona and across the nation? So a little bit about your work and then what this campaign is. Can you ground us?
Sure, thank you. So for context about mass liberation, we are a directly impacted led Black liberation centered organization that does the primary bulk of our work in South Phoenix. For those of you who are familiar with South Phoenix, you already know that that is one of the most heavily policed, incarcerated, and paroled geographies in all of Arizona. And it's arguable that it might be within the top 10 in the nation. So when you think of Arizona as the fourth largest incarcerator in the country, you're thinking of those two particular zip codes in South Phoenix as the main contributor to those. And for those of us who know the history of Phoenix, we understand that due to redlining and historical racial inequities, that is primarily a Black and Brown community. So this is why we find ourselves there. Our goal as mass liberation is to end mass incarceration, and we end up in South Phoenix because those are the folks who are heavily incarcerated, and folks that return back into communities. And we all know that reentry is a problem in this nation, and it's specifically a problem in South Phoenix. And so we try to help with folks coming back in and reintegrating into society. When I say we're directly impacted, that means that the folks who do the shaping of our work are formerly incarcerated. I myself am formerly incarcerated. I spent 10 years at Perryville Prison. And I paroled back into that zip code. And so I have all of the lived experience on my body of what it takes to reintegrate, what the afterlife of incarceration, if there is one. Right? I would argue that potentially we are still incarcerated in many ways, right? And so I have that lived experience, and the folks that lead our work are folks who also share in that experience as well. And again, Black liberation being the center, because we believe this is a wide net cast to catch Black people. Policing is the afterlife of paddy wagons in slavery time, and incarceration is the afterlife of transatlantic slavery. We believe that. And so since it's a wide net aimed to catch Black people, other people do get caught in it. But by setting Black people free, we set everyone free. So that being said, we have launched a response to COVID. We're trying to work with public health care to understand the vulnerabilities of people who are currently incarcerated. There are plenty of experts who are releasing data that are saying that it's a ticking time bomb. It's not a matter of if, but when people inside prisons are going to be disproportionately impacted. That we aren't going to be able to mitigate the harms and potential deaths that are going to take place because of the failed response of the prison to be able to take in the CDC and the healthcare global recommendations on how to prevent the spread. We're seeing that here in Phoenix. Mass Liberation works with people who are currently incarcerated. I mentioned that at the beginning. We receive emails and letters from people who are telling us what the conditions are like. And so we've taken our leadership again from those directly impacted, and we have worked on compiling a list of demands for several officials. And we need to make sure that the message is coherent, and we are in partnership with the experts, public health, for example, and also attorneys who are doing the work of litigation and putting pressure on the state. And that's really why I think it's important for us to have this conversation here today with all of our positionalities. I see some grassroots faces here, folks who can and are doing this work as well. And so I'd also like to lift that up, as well as we're partnering with, I think it's 27 different grassroots organizations, both local and national ones, to bolster these demands that we'll get to, I think, here in the conversation. Mary, did I do it? Should I build a little more? Uh-oh. Can you hear me, Mary? Are you there? Passing it back to you. Well, and okay, and I don't hear Mary, so I'm going to continue talking because I don't hear Mary. I'd love to introduce some of the other folks that are here on the call as well.
Okay, go for it. Yeah, go for it. No, go for it. Do it.
Okay. Well, yeah, I was just going to pass it to Heather because I think that makes most sense for someone to come after and share a little bit of the framing from your positionality. Heather, would you mind? Heather's on mute. Joe, you might need to release her.
Joe, you have to unmute folks. And thank you, Lola. That's where I was going. So perfect. We were in sync.
Awesome.
And, yeah.
Go on, Mary.
Yeah, I was going to just ask to kind of ground that in the public and human rights as an equity issue for us. So building on, and then also, why is this such an important public health issue?
Well, and I think as Lola explained, their mass incarceration was already a public health issue prior to COVID-19. And hopefully Jared from the ACLU will be able to talk a little bit about what the conditions are like inside of some of our correctional facilities, and how people struggle to access healthcare, to get appropriate healthcare, and why a lot of the population who are incarcerated inside prisons, inside jails, inside immigration detention facilities are oftentimes struggling with many underlying health issues that make them particularly vulnerable to these outbreaks. But I think in kind of framing this whole conversation, because this group of folks has been largely left out of the national dialogue about how do we respond to COVID and how do we craft governmental policies that are going to prevent this spread of this outbreak. A lot of people think that those prison walls are going to protect them both inside and outside. And obviously this virus doesn't respect those prison walls that have been erected. And those folks inside are part of our community. These policies that are being crafted right now are community responses that are trying to protect community health. And people who are incarcerated are part of our community. And so what happens to them impact all of us, and vice versa. And so that should be kind of the framework for this conversation. And that's why it's necessary to approach this with these folks in mind, because they've largely been left out. And that's a major gap in our analysis. And that's a major gap in the ways in which we craft policies.
Right. Jared, can you, so Heather mentioned about the specific conditions. Can you help us understand exactly what prisoners or folks on the inside are experiencing every day and where you're seeing those gaps in terms of their safety and their health? Can you talk about those conditions?
Certainly. Thank you for having me.
Yeah, thank you.
So the ACLU of Arizona, the National ACLU, the Prison Law Office in California, and some other folks filed a lawsuit against the Department of Corrections in 2012 related to their inadequate healthcare, dental care, and mental health care. And the case was settled in 2014. But since then, the Department of Corrections has basically failed to comply with what they agreed to, the types of what they agreed to provide the inmates related to medical care, mental health care, and dental care. But part of that settlement gives the attorneys on the case extraordinary access to the prison. So we get to go into the prisons, and there are very few areas that we're not permitted to actually physically visit, speak with those in the prison who are all our clients, a part of the class. And so what we're seeing is a Department of Corrections facilities that are completely unprepared for an outbreak, a pandemic outbreak, or a viral infection outbreak in those facilities. So even before this pandemic, there are, the Department of Corrections isn't even able to provide medication to those in prison on a timely basis, right? So there's delays in medication. If someone, if you're transferred from one facility to another facility, you don't necessarily get the same treatment you're receiving in the prior facility, right? That seems like a no-brainer. And what later I'll show you some photos of just sort of the awful sort of conditions that some of these prisons are in, and just the pictures will speak volumes to how easy a virus could spread in that type of environment. And so that's what we're seeing in these prisons, right? A system that's just completely ill-equipped to deal with a potential outbreak or an outbreak when it happens.
Mm-hmm. Lola, something we talked about yesterday that I want to touch on, and I wonder if you can build on this, is you talked about people on the inside are there to serve a specific sentence, and not taking care of this issue then becomes a different type of sentence. And I wonder if you could talk about that, and a violation of the Constitution in a different way. Could you build on that conversation earlier and maybe talk about that?
Sure. Yeah, so Arizona is a punitive state. There are states out there that are supposed to do rehabilitative work, and that's a conversation I think attorneys are really familiar with. But Arizona is a punitive state. It incarcerates people solely for punishment. I think where the community and the public, and even the folks inside, and the folks, the administrators of the prison, get confused, is that people go to prison for punishment, as punishment, but not for punishment. Like, they don't go to have like the worst possible living conditions and the worst possible accesses to healthcare and family members and support. That's is not what prison is for. Going to prison and being removed from society is the punishment, and it ends there. It's actually the state's obligation to take care of people who are currently incarcerated. It's their obligation to make sure people maintain their health, maintain their bonds, and are able to return back to society in a healthy sort of manner. But what I think has happened, and I think this happens through the media, it happens through just the divorce from our own society understanding or looking at prisons closely, that it's become a thing where we believe that people go to prison and that they're supposed to receive extra punishments while they're there. COVID-19 and the exposure to this deadly virus leaves people in a position where, we didn't talk deeply about the margins and where people are struggling to access healthcare, but people who, even out here, right, in the free world, so to speak, certain folks live in the margins. That's why we talked about why we organize in South Phoenix. Those same people who are predisposed to incarceration based on the geography and their bodies, those people are also predisposed to not having access to healthcare. And the same thing is true. So folks inside, if those margins are the same margins, people end up going to prison are the same people who have issues with healthcare outside. So people come in with preconceived or pre-existing conditions. People come in with real healthcare issues, and they're neglected inside. And we'll see ACLU, what Jared was talking about, and the previous lawsuit of Parsons really underscores and creates evidence around that. Those same people who are struggling for equity in healthcare, who are inside with preconceived or pre-existing conditions, are now exposed to a deadly virus that we can't protect our community out here from, right? And so those people who are inside, who are not now able to even take the measures that the World Health Organization, the CDC, and everyone has agreed upon to social distancing, to quarantining in your homes, they don't have that ability, they don't have that luxury inside the prison. I think that even quarantining, when we think of people who are unsheltered as well, that is an act of, or that is an option of privilege. So those people who are inside don't have that access. So when they are put in a position of harm's way and they are more likely to contract this disease because they can't socially distance, they're going to receive an unconstitutional death penalty. No one who was sentenced to go to prison for anything, including people who've received the death penalty, were sentenced to die at the hands of COVID. Right? Even people who are scheduled to die by lethal injection, they were not sentenced to die, right, by some respiratory failure and the failure to offer them adequate medical care. And DOC knows that, right? They put people in death row into solitary confinement, and they don't give them razor blades. They don't give them pens. They tell them, we're not going to let you kill yourself. You're going to die by lethal injection. That is how DOC operates. So by that same notion, they still are required to preserve the life of even people in death row. So the argument of guilt and innocence is just it's a non-starter. That's not what we're here to talk about. And our work in mass liberation is really around centering healthcare, centering public health, and also recognizing the risks that they're taking are also going to impact the general public, and that we have 1,500 ICU beds here. And there are people on this call who understand that when someone gets sick at DOC, there is an external acute healthcare provider that has to take care. Those beds are the same beds people at DOC are going to go to. So when you have institutions like that taking these types of risks and failing to listen to the World Health Organization and CDC and putting people in a position where they are going to, again, it's not a matter of if, it's a matter of when, have this virus spread through the institutions, you're also now putting people who are already have acute health issues, already getting underserved by hospitals, or I'm sorry, by medical, right? Those folks are now going to be the ones who are going to need the beds more than the community is. And so we're going to be fighting for beds, 1,500 beds, when we have 60,000 prisoners who are more likely than we are to catch COVID. So it's a public health issue. It is a huge risk to the community, but it is also an unconstitutional way of setting people up to die in prison where they were not sentenced to do that.
Thank you. Thank you. I wonder if one of our other panelists want to respond to that. Jamar, you're on mute if you're talking.
All right, I'm off mute now. I think, you know, one of the issues that Lola mentioned is that, you know, it's sort of, the problem is really exacerbated because the people who are getting, and I guess I'm speaking from a pre-trial detention perspective, the people who are getting scooped up and put in jail are already members of our vulnerable populations, and now they're going into a facility that's managed by a company or you know, an industry that isn't prioritizing CDC recommendations or isn't prioritizing health services and concerns even before the pandemic. So now that we're in a pandemic, we can't trust these systems, and we really need, as practitioners and as attorneys who work with this population, we really need the assistance of other industry professionals and other health professionals to highlight these issues and to emphasize the need to care for these populations who are often forgotten populations. One of the things that's concerning to me is, you know, oftentimes correctional health services, who's a medical provider for people in jails, they'll say to us, oh, we're taking all of these measures, and they're preventative measures. If our governor or if the mayor or if any of our elected officials or even, you know, health officials came out and mirrored the measures that correctional health services is saying that they're taking in the jails, they would get crucified. They would get thrown out of office because they're all preventative, or they're not preventative, they're all reactionary measures. When someone gets sick, we'll do this, or this is how we're trying to identify people who are sick, when we know we have to do more than that to ensure the health and safety of our community members.
And sorry, Mary, if I may kind of put an even finer point to what's been said. Like Lola said, it's not a matter of if an outbreak happens, it's when an outbreak happens. An outbreak is inevitable in these facilities, partly because of the conditions that people are held in. They're held in close quarters with an inability to socially distance, and basic hygiene necessities that we all are using, like hand soap every day or hand sanitizer, are difficult, if not impossible, to obtain. They don't have surgical masks that are circulating around inside of these facilities. So the ability to socially distance and the ability to practice heightened hygiene is all but impossible. And we have, like Lola said, about 60,000 folks spread out amongst our correctional facilities. We have 42,000 in state prisons. We have 5,000 in federal prisons, 14,000 being held in our jails, rotating in and out of our jail facilities, and about 3,000 in immigration detention facilities. So to kind of illustrate what that is, that's if you packed the Staples Center, 3 Staples Centers, full of people every single day. And that's what we have right now. We have a large group of people being held in close quarters every single day, who are unable to take preventative measures to protect themselves. And so it's inevitable that this outbreak is going to occur. And so I think what we should talk about is, like, what happens when an outbreak occurs inside these facilities. And I think, you know, obviously they start spreading like wildfire. And what does that mean in terms of, if 64,000 people get sick or get exposed to this, what does that mean in terms of our beds? We only have 1,500 ICU beds in the entire state of Arizona. So if only 20% of that population were to get sick, we're already looking at taking up 33% of bed capacity. If 50% of that population got sick, we're at over 80% of our ICU bed capacity. And if 80% of that population got sick, we're blowing our healthcare capacity right then. And I don't think it's unreasonable to say that we could anticipate that if an outbreak were to occur, that 80% of the population would become infected. In fact, that's what the Imperial College report that was issued, the report that has basically underlined worldwide government policy in terms of how to respond to this crisis. The recommendations made in that report, one of the things that they noted is if there are not any preventative measures being taken to reduce person-to-person contact, then they predicted that within the US, 81% of the population would become infected in 3 months. And the conditions that they outlined as if you guys don't do X, Y, and Z, if you guys don't socially distance, if you don't close schools, if you don't mandate heightened hygiene practices, then 81% of your population is going to become infected. Well, that's what we're looking at in these institutions, those very conditions. And so if an outbreak happens, it would very quickly overwhelm our healthcare capacity, which means these institutions are single-handedly undoing all of our collective efforts to flatten the curve.
Jared, oh, sorry, go ahead. Lola. Joe, she's on mute.
Yeah, I wanted to say too that there are already 25, close to 2,600 people sick in Arizona already, right? So there's already, those 1,500 beds are already depleted, right? And there are other undiagnosed cases because our state itself has been slow to respond.
Yeah.
We don't actually know the risks. I mean, this is just like, this is like best case scenario, I think what Heather is saying. And I think that's frightening. And I think we as a community, we as officials, we as grassroots organizing, we as folks who have every right to make these demands need to really start to think about why are we prioritizing punishment over health of the entire state, right? And arguably the country and the world, right? Why are we putting punishment above those things? We have seen that other states have recognized this as a real health threat and have already started to release. I think 13,000 people have been released in Los Angeles alone because they're getting their priorities straight. And I think it's time for us to do that as well. I think that detention centers are a great example. There's no argument even over innocence and guilt in terms of criminal, right? The criminal aspect of this, right? Where folks are like, you know, usually saying, I think I've seen publicly folks saying, why would we release people from prison? They're criminals, right? We don't have that same argument in detention centers, yet we're still holding very tightly to releasing people from detention centers. There is absolutely no reason why we couldn't release every single person from a detention center. Every single person. It's just really that society is focused more on punishment than it is for public health, and that's got to stop. And I think it's a shift in the public narrative that is super important. I do want to, just mention too that it's a double standard, right? So for the lawyers here, I think who know this, criminal negligence, I think that the definition is when you fail to perceive a risk that can result in harming another. So that's exactly what DOC is doing when it's single-handedly, like Heather put so eloquently, single-handedly is undoing the work we're doing to flatten the curve. They are failing to perceive a risk. This is on the best case, right? They're failing to perceive a risk that can result in the death of others. That is negligent homicide for every single body who dies. That's the state standard of that. Like that's what our law says. And then what it really, I think, amounts to is manslaughter, because that is a little bit higher a threshold where it says that if you fail to perceive a risk that can and will result in the death of others. If you let the state charge an individual for something like this, if you let the state charge in the capacity that they're used to charging people, which is to inflate charges, this is murder. And that I wanted to just share that and put it in context. I see Jamar, you're raising your hand, so I'm gonna go on mute for you.
I just wanted to emphasize how ridiculous this is, and just as a I guess a legal emphasis on the points that you were making, the purpose that that our prosecutors and our judges and our city officials and state officials, they tell us all the time, the purpose of release conditions is to ensure that people come to court, right? And we have thousands of people who are on monetary conditions of release right now, so they can't get out of jail just because they can't pay their bonds. We don't even have court right now. So we have to ask ourselves, why are we keeping people in jail on bonds to ensure that they come to court and courts are canceled.
So we're at about halfway. I want to go back to Jared. Am I on mute? I want to go back to Jared if you can show those photos, because then we want to turn to what healthcare professionals can do and what we're asking for. And I want to highlight something that came up in our pre-call yesterday. When we talked about who we might invite from the healthcare field, public health, healthcare, we all found it profoundly difficult to think of someone who could represent, who is deeply engaged with this issue currently. And I think this is an invitation to healthcare professionals, whether that's frontlines workers or public health sector for the city, Maricopa County, to be thinking about where is this issue in terms of your priority list? And how can we show solidarity, not just in terms of the symbolic, but in terms of bodies on the line and the work that we do. And so that's the invitation on the switch to Jared, who's going to show us the internal conditions, and then we'll move to the ways that healthcare professionals and public health sector can ally to make this a priority. So Jared, please.
Yeah, I'm not sure how to share my screen.
Oh, you have down at the bottom, it says share screen.
Oh, yeah, I'm looking at the other, got it, okay.
And if you have your thing up, it'll come up.
All right, so this should hopefully work. Can everyone see that?
Yes, it looks
Okay.
like a dispenser of some kind.
Yes. So, okay. So I want to be clear. These are these photos come from a Department of Corrections facility. So this is a state prison run by the not one of the private prisons, but one of the 10 facilities that's run by the state. And so this was in a this dispenser was for Perel hand sanitizer. This is in one of the medical offices in the prison, and so they're out of hand sanitizer for the medical staff, let alone the people who are serving time in prison who don't have access to it ever anyway. Here's a photo of the lavatory facility in the medical office in the prison, right? They don't allow inmates to use it, as you can see. I'll try to go through these quickly so we don't take up too much time, but those plastic sheets are attempting to prevent rain from getting in to this tent facility that houses people. Here are some other photos of ripped plastic sheeting to prevent leaking. Here's some of the lavatory facilities that the inmates are forced to use. And I will warn you, these photos do get a bit more graphic and disturbing with some of the sort of conditions that you'll see momentarily. But here's some more lavatory facilities with urinals taken out. This photo sort of gives you an idea of how closely people have to people live next to each other. And so as was brought up a few times, I think Heather mentioned it, right? It's physically impossible to socially distance in this type of environment. And when someone contracts COVID-19, it will spread very quickly through anyone in prison. That's to do, well, we'll skip that. Here you go. This one here, this next one is, they charge the inmates for soap and other sorts of necessities, right? So if you don't have access to money, you're not going to be able to access things like soap. If you don't have money, you get one of these fresh scent soaps. So this is simply a deodorant soap, so very not very helpful in sort of containing or helping with killing germs, but this is about the size of a business card. That's what they refer to as indigent soap for those who can't afford to purchase soap. Let me skip down here. Here's a shower facility or a shower in the facility. These next photos are the more disturbing ones. These are in some of the more units where they sort of isolation units. So either people on suicide watch or people who they've deemed to be some sort of threat. You can see just how gross the conditions are. right? And so if you're living in these conditions, which people are forced to live in these conditions, you know, clearly any kind of virus or even bacterial infection can spread very quickly. This thing here, that's the eating utensil that was left on the side of this sink. And so I hope that wasn't too quick to go through those photos. I just didn't want to take up too much time, but if there's any questions about them, I can maybe dive into those as well later. And, you know, one thing I'll say before, since some people are on mute, you know, it was mentioned how harsh Arizona sentences people. And so one outcome of that is that people get very long sentences, even for very minor crimes, and they age increasingly. Our prison population is getting older and older, and there's much, you know, social science, I'm sorry, medical research on people 50 and over, 60 and over, right, having much higher chance of not only contracting coronavirus, but having much more serious outcomes when they do are infected by coronavirus. And so by imprisoning people for longer and longer periods of time, you inevitably have a much older population, a higher risk population in our prisons.
Thank you. Thank you. And we're going to go back to Lola. Also, Lola, just 1 second. I want to, Sophia, thank you so much. Sophia is talking about the work of Patch, the Phoenix Allies for Community Health. They do excellent work, and thank you for offering that as a corrective in terms of healthcare professionals on the front lines who have been doing important work. I do want to uplift that and make sure that we don't let that slide off to the side, because they have been doing important work for decades. So thank you for bringing that out. Sorry, Lola, please.
No, just a couple questions for Jared. First off, Jared, are those photos able to be made public? Are we able to share those, or are those something that you want to keep close? And then my other question is, the DOC, it's my understanding that DOC made some excuses for some of those photos, and if you might be able to share what that is, because if that's the case, we need to be thinking about students grading themselves and not trusting numbers and words coming from DOC.
Yeah, I believe we can share them. I will get back to you, and if so, I'll send them out. Related to DOC's, I mean, DOC for years has not complied with the, and let me back up. When I said that, you know, this case, this Parsons case, Parsons v. Ryan's case, or now it's Parsons v. Shin, this case was settled, right? It was settled in 2014. So the Department of Corrections agreed to a number of, it wasn't a court demanding that they do a number of different things, right? They agreed to a number of performance measures that they were going to track to make sure that they were providing constitutionally adequate medical care. This isn't, you know, good healthcare, right? This is just like the bare minimum that the Constitution requires. And so they agreed to these sort of performance measures, and then since then have failed to comply with them, while fighting, you know, sort of tooth and nail at every turn in court as well, right? So I suppose any explanation coming from the department should be taken with a grain of salt, a large grain of salt, because they've shown themselves over the years to just be unwilling to comply with what they agreed to in 2014. I hope that answers your question.
Thank you. Oh, okay, I don't know if Lola's off mute. So I want to we have about 15 minutes left, and I think it's important that we leave with a conversation about how specifically public health and the public sector that is concerned with this can help ally in solidarity, but also use their platforms to, as Lola will talk about, there is a call to action, and how healthcare professionals who are interested or in places of leadership can help. I want to turn it to Heather first, then Lola, just to give you, Lola, a few minutes to think about it. And Heather, can you kick us off at how folks from the field could help in this way? What are those calls?
Well, first of all, I think what we're seeing in this moment is governments and government officials are largely being led by the expertise of medical professionals. Medical professionals are shaping government policies, they're shaping our responses, they're shaping the recommendations, as they should, because they are the experts right now. And I think what would be most helpful in this moment is for medical professionals who are shaping these conversations or have the ability to shape these conversations to take into account what policies need to be in place inside of these correctional facilities. What do our prison officials need to be doing? What do our jail officials need to be doing? What do our police who are continuing to arrest people and put people in jail, what do they need to be doing? What do immigration detention facilities need to be doing? Because so far what we've crafted is we've crafted policies that largely leave these folks out. And as we reviewed multiple times in this conversation, it's like our collective health is not separated from the health of folks inside. When we're talking about public health, we're talking about the entire public, and that includes folks who are incarcerated. And so any policy that's crafted needs to be also crafted with those facilities in mind, particularly because, like I said, we're in Arizona right now, we're housing 3 Staples centers worth of individuals in close conditions, in conditions that are ripe for an outbreak. And so that really has an impact on what our public health looks like.
Great. Lola?
Yeah, everything Heather said, it's that holistic approach. It's showing up and really underscoring some of the concerns that we're raising and talking about publicly the impact on public health, right? Like, so what does the failure to respond result in for public health across the board? And particularly for practitioners who are already experiencing shortages and the inability to treat patients even at the scale we're at today. And it isn't really something we can wait on. Like, this is something that we need to see circulating and being made public now, like urgently. And that is like as urgent as not even to the end of this week. Like, we need to make a decision as public health, and we need to start raising our hands and raising flags and putting all of the pressures in all of the places we possibly can. There is a really strong grassroots movement taking place right now. There are people, organizations that are pulling together. There are coalitions that are forming. There are petitions that are circulating. I would love to be able to, at the end of this call with InSite, be able to share what all of those are and invite every single person here to sign on to those petitions, look out for those public actions, and do your best to, as experts, support these actions. There are, I'm going to read the list of some of these organizations, so keep your eye out for them. Puente Human Rights Movement, of course, Mass Liberation Arizona, Alliance for Global Justice, Radio Cachimbona, I said that not so well. Never Again Action, No Mas Muertes, which is No More Deaths, Trans Queer Pueblo, Schools of America Watch. Why it's important to think about this as coalition work is that we are all organizations who do different work. I'm sorry, Black Lives Matter Phoenix Metro is also working, Black Local Organizing, I'm sorry, Phoenix Local Organizing Committee and Black, oh God, I'm so sorry, Paris. It's Black People's Organizing Collective, BPOC.
Hey.
And I do want to list some of the other partners that we're working with, because this has been a long, hard process for us to be able to identify concerns and reach out to our bases, and everybody has shared in the collective drafting of our demands. So it's also Poder in Action. It is also Fund for Empowerment. It is Reframe Youth Arts Center, who Ashley Hare is one of the founders of. It is Color of Change on a national scale. InSite Consultants is one of our partners. National Lawyers Guild, Central Arizona Chapter, South Mountain Services, Tucson Second Chance Bail, Community Bail Fund, Lucha, Living United for Change in Arizona, Arizona Palestine Solidarity Alliance, Unitarian Universalist Justice Arizona Network, Imagine Life Arizona, Black Mothers Forum, Food Not Bombs, Black the Vote, another national organization, the START Project, which is a reentry organization out of Tucson, White People Against White Supremacy, Arizona Justice Alliance, Liberation PAC, and District 8 of the City Council have all named themselves as partners in this work. And so this is an invitation for all of the public health representatives here to sign your names to that list and to do the work of pushing the agenda, signing petitions, distributing petitions, and then following the leadership of directly impacted people on next steps. That is super important. There are actions that are going to be taking place, and all of those pressures have got to be in relationship to public health care for folks to take us seriously. And so, so it's an invitation in that way as well. And thank you for muscling through listening to the list of partners. It's really important that we make sure we make visible all of the solidarity.
Jamar, I don't know if you can hear me. Do you want to add? Oh, there it is. Great. Thanks, Joe. Jamar, do you want to add to that? I think we're trying to get him off mute.
Yeah, I think you're still on mute.
Joe, can we pull Jamar off mute? So Lola, I'm going to come back to you. We have on the screen some of the ways in which you're calling on healthcare professionals to ally. Can you walk us through this list a little bit?
Yes, one other thing I did want to say about the list of organizations that are throwing down for this is I want to say that there are organizations that are focused like Mass Liberation on Black Liberation, Trans Queer Pueblo on detention centers, and the folks that are in the margins, trans LGBT and trans community members. There are folks with specific deportation cases who are doing the work, and we invited everybody in, and we are all working together because as organizations we represent specific pockets of the margins. And so I wanted to say that because I want to make visible that not any one organization can do this alone. So shifting focus to the public care, what can public health do? We're calling for transparency. You'll be able to read a full agenda and you'll see that there is a bit.ly link at the bottom of this graphic that guides you over to the full agenda. But ultimately, transparency is about requiring DOC, requiring detention centers, and requiring the county jails to be clear about who is sick, how many people are sick, contacting family members and making sure that people are aware that their family members are sick, being clear about the impact on their system. Do they have toilet paper? They don't. Do they have soap? Jared showed us the indigent soaps. That is a soap that they're handing out to people on demand. And I have talked to over 30 people in the women's prison and no one has been able to get soap on demand. So being transparent about shortages, being transparent about things that are happening. And for instance, there's an entire issue around how they're selling toilet paper to guards, toilet paper that could be state issued to people inside, right? That is an example of something they need to be transparent about. And so data, right? Mary, do you want me to move through all of these with?
No, I just think, helping us make some touch points. Something I want to bring up, Heather, you posted this a couple of days ago, but since that posting, there's been a number of other articles from The Atlantic, the New York Times, many running the gamut, that new data is coming in that is demonstrating that COVID impacts people in deadly ways along racial and gendered lines, but specifically race and class. So we're already seeing that this is a highly racialized and highly class disease. And I want to be clear with everybody on the call how important that is to recognize that. Because when we're thinking about prison populations, we are thinking about disproportionately high Black, Brown, Indigenous populations, and an increasingly vast amount of women who we also know are rapidly susceptible to death by this disease. So I wonder, again, if we can think of the urgencies in terms of the population and touching it to what's happening on the outside and how that's also reflective of a racial inequity that's happening, and how healthcare professionals can be thinking of this through that lens, that if we're really thinking about those that are most impacted and we think of racial justice in our work as healthcare providers, how this is exactly the front lines issue. And then I also, so I want to go to Heather for that. And I also want to uphold Alejandra's call that there is a demonstration at ICE. So please look into the chat for that, because that's a moment of solidarity. So I want to uplift that into the chat. But Heather, could you reflect on that a little bit, that kind of parallel world?
Yeah, well, like you said, we're finally getting statistics out on who are the populations that are most vulnerable to this. I think a big one that came out recently was in Detroit, where it's like 72% of the individuals who died of COVID-19 were Black, despite representing only a fraction of that in the population. And we're seeing those statistics repeating themselves kind of across the country.
Right.
And there's lots of reasons for that. Centuries of institutional racism, environmental racism, which are underlying health conditions and produce underlying health conditions. But particularly in Arizona, the majority of those individuals who are incarcerated in our prisons, in our jails, in our immigration facilities are Black, Brown, Indigenous, people of color. And if you think of who is the most vulnerable, it's individuals within those populations who have pre-existing health conditions. And that's exactly who we find wind up in our prisons. So not only are they being held in close conditions that make an outbreak inevitable, but these are also individuals who are going to be the most vulnerable to infection and probably the most likely to need those ICU beds, which is why I said I think the numbers that we've come up with today are fairly conservative for what happens if there's an outbreak inside. And what we see is our healthcare system is completely, our healthcare capacity is completely overwhelmed.
Yeah, thank you, thank you. So we have about 5 minutes left on this call. I want to ask if there's any of the folks, so Jared or Jamar, Lola, is there any last things you'd like to say before we either open it up, and this would be a good time to jump to the chat or more questions from folks. But is there anything last you all want to touch on? Please, Jared.
Yeah, thanks. I just got a couple things. One is, there's not just one healthcare system in Arizona, right? And a lot of these prisons are located in rural communities that have very few beds available. And so if there's an outbreak in a prison in like Kingman, that is completely different than an outbreak in Metro Phoenix, right? The devastation to that local community is going to be much greater and much quicker than it would be in places where there's more hospital capacity. And then, one thing that I've noticed is sometimes organizations who have pushed for decarceration or criminal justice reform generally before this outbreak are often written off as like, well, they're just now using this outbreak to push again for their agenda. And I think that's where public health officials can come in strongly and say, no, like the only way that our communities are going to be safe and people in these jails and prisons are going to be safe is if we rapidly decarcerate now before there's an outbreak. And that message coming from public health officials right now is much, much stronger in many ways than coming from an organization who's sort of pushing that for other reasons.
Yeah, I just want to echo that. That's super important. Oftentimes when we go up against the institutions that incarcerate at these large numbers, they, it's just us. It's the people that they're familiar with telling no. But now is really a moment of solidarity for us to really put into practice what we say that we care about as professionals. And it's really, and we need it. We're not going to be successful without that solidarity.
Thank you. Lola or Heather, anything last? Seeing any other questions? Thank you for the share screen. We did remove that. As we conclude then, thank you all so much. I think we need to speak candidly that Arizona's response to COVID-19 has been, and it's been noted politically, it's not just me having this opinion, has been abysmal at best. And we have in many ways been betrayed by our governor at multiple levels in this. And he has prized at every level private corporations and large scale corporations over people's health. And so when we're thinking about folks who are most impacted in this space, it is going to take all of us stepping outside of our comfort zone, stepping outside of our job descriptions to say, because we cannot rely on the state. We cannot, well, maybe the city a little bit, but not the state. We need everybody in this fight. And I think this is the time to kind of step outside of your comfort zone and say, well, it's not really me. We haven't done that before. And I don't know if the board is ready. We are talking about thousands of lives that will die overnight in these conditions. Some of us are directly impacted because we have folks on the inside that are close to us or family members, but even outside of that, even if we have no one on the inside, when these folks become infected with this disease, they will go into the hospital system that we have here. So this is all of our fight, and we need healthcare providers on the front of that. So Vitalist Health Foundation, I'm looking at you and other folks on this call. So if there's anything else, I think we are at time, or any other questions that we can see. Then with that, if you do have questions or you want to get involved, please reach out to Mass Liberation. They can answer questions. They can have more of a one-on-one. This is an hour-long primer. So if you need to get more in depth, Lola can answer that. Heather can help with that. Any of our panelists you can reach out to talk with them about that. So thank you all so much for being a part of this conversation today. And thank you all to the panelists who stepped in to help us think through this complex issue. I'm looking at Renaissance. Thank you so much for posting. Great, there's some things coming through. And there's different articles that are in the chat. So I would definitely grab some of those before we log off, so. Great. Joe, I can't see you. I just want to offer this over to Joe. Can you click? Oh, he's probably off. Then, okay, then I think that's it for today. Oh, there you are. Joe,
Thank you, everybody.
Great, thank you. Awesome. Thank you all so much. Thank you.
Thank you.
Thanks. Have a good day.
What's funny is I think Jamar thinks I'm waving at him, but I'm waving at you, Raji.
Sorry, Jamar.
It's nice to see your face.
So good to see your face too.
You want to FaceTime?
I would love to.
Okay, I'll call you.
Okay.